Okay, hi, my name is Carrie Margaret Butch. I am the Community Engagement Coordinator for the Center for Environmental Exposures and Disease, and I'm here to welcome you to EOC's third Environmental Health Summit. And the name of our summit is COVID-19, Environmental and Occupational Health and Justice. Today's session is Stress as a Factor in the COVID-19 Pandemic, Developing Resilience in Families and Children. And as we do every week, let's collectively recognize all who were a part in making this session happen. And we're going to thank all of you for attending. We will, however, need to single out Maria because she goes above and beyond with her, Maria Crescenzio, with her amazing technical assistance, as she does every week. We are very, very fortunate at Rutgers to have two very, very smart women working with us at Rutgers. Nancy Fiedler is a professor at the Rutgers School of Public Health. She's also our deputy director at EOC. She's also the chair of the Biomedical Health Sciences Institutional Review Board, and she does a tremendous amount of research. Some of her research in her past has been on chemical exposures and psychological stress. She's done some investigations on among workers chronically exposed to solvents and lead. And what I most know her for is her studies based in Thailand, where she's investigating the cognitive and behavioral effects of pesticide exposure on children. Additionally, we have Nora McKendrick. She's an associate professor with the Department of Sociology. Nora's research falls within the field of medical sociology, environmental sociology, gender, science, and technology, as well as consumer studies. She's the author of Better Safe Than Sorry, How Consumers Navigate Exposure to Everyday Toxic, and that book identifies the rise of the precautionary consumption in the United States. In her other research, Nora has examined the intersections of risk, individualization, and modern motherhood, as well as the dynamics of non-toxic consumption, foodscapes, and science activism. But we are really, really lucky to have both of these women on board at Rutgers, and they created this session, took a deep dive, and I'm looking forward to it. And I'm going to hand it right over to Nancy right now. With the caveat that please enjoy the chat. We are going to be using the chat and we are going to be checking the chat. So enjoy that chat. Thank you. Nancy, I'm handing it over to you.
Okay, I'm going to hit share now.
Nancy, let me just jump in for a second and
Sure.
remind participants, if you want to put a question, if you want to ask us a question, or if you have a comment, put it in the chat. We'll be monitoring the chat.
Okay. So we're delighted to be here today. We appreciate everyone's participation in talking about stress and COVID. And I want to just emphasize that it's really appropriate that we're talking about that today, since the World Health Organization has declared October 10th as Mental Health Day. And so I think it's appropriate to consider how our mental health and our stress is affected by the current pandemic. Okay. We're going to talk today with parents, teens, and young adults about their experience of coping with COVID. We emphasized today that we went into the community. We wanted to hear from individuals and what they are dealing with and the kinds of situations they find themselves in as a result of COVID, and provide some background about the conceptualization of stress, but also some real voices about what's going on in our communities.
So Nancy interviewed 3 parents, and I helped to organize a kind of focus group or group discussion among youth associated with an organization in Camden called the Center for Environmental Transformation. And Nancy's questions for parents asked about how they were managing work and family life, their financial worries, how they juggled school, daycare, and childcare closures at the beginning of the pandemic and in the following months, and how they're coping with social isolation and where their sources of support are coming from. And then I spoke to youth, or I developed a set of questions with Nancy and a youth coordinator to understand how youth coped with life under initial lockdown when schools closed down and then they were at home most of the time, what it was like to get back to normal in the late summer, how other family members are coping with the stress of COVID, and how they're thinking about the future. So these are the youth who participated in the youth discussion group. I didn't participate. I provided Dimitrius, who you can see in the center, with a set of questions, and he moderated the discussion and I recorded it. And I told them I would stay out of it. And the advantage of this was that they could speak a little bit more freely and a bit more informally without having a researcher peering in and listening to what they were saying. So the four youth, they all spoke. They're all interns at this organization, the Center for Environmental Transformation at Camden. So we have Dimitrius in the center. He is the farm stand manager, and he moderated the discussion. He, at the beginning of the pandemic, he had to leave his college and move back to Camden and move back in with his mom. And then he moved out into his own apartment, and we'll hear a little bit about that. At the top, we have Henry. Henry's a high school student. He lives at home with his sister and her partner and their two small kids, as well as his mother. Then we have Fabian in the center. Fabian is a high school student living at home with his parents. He talks a bit about what happened to his family with the arrival of COVID. Then at the bottom, we have Celeste. Celeste is a college student at Rutgers Camden. And she spoke about the transition to online schooling and being at home all the time and taking on more responsibility at home. Celeste also talked about the impact on her household under lockdown when their hot water heater broke down and they couldn't get it repaired. And in fact, it was the stimulus checks from the government through COVID relief that allowed them to repair it. Unfortunately, the video for Celeste wasn't of great quality, so we're not able to show clips. But I will say that these youth spoke for 2 hours about their experiences, which was fantastic, but we're only able to show just a few clips this morning.
So just to get us oriented, I want to talk a bit about what is stress. I think if all of you look at this picture that I took from the internet, it's pretty obvious that when demands exceed the resources to cope, that is often how we define stress. We use the word in general terms often, but I want to be clear that a part of the stress is that the individual's involves the individual's perception of the demands. So what might stress one person may not be stressful to another unless the demands are so intense that almost all people would be stressed. And I would make the case that there is a lot about this pandemic that is pretty universally stressful, although it produces somewhat different responses from people. But Lazarus is the person who really, the psychologist who talked about, the demands exceeding the ability to cope. We also know that demands that are unpredictable, that are dangerous, uncontrollable, I hope those things sound familiar to you when we're talking about the pandemic, because there was a lot about it that fits all of those categories. Those can cause stress, particularly if we don't have the resources to cope. And I think you'll hear when we talk to various people, sort of how they're coping, but also how it's been pretty overwhelming. And I just want to highlight a paper or a brief article from NPR about This Is Too Much, and that working moms in particular are reaching the breaking point during this pandemic. As we all know, often the women are more impacted because they're working at home and taking care of kids at the same time and trying to also help teach them. Not to say that fathers aren't involved, but often women take more of that burden. And it's really highlighting some of the gaps in our system. So the demands may be physical, and I just want to highlight some of the things that we know about COVID, that it's difficult to maintain social distance while working. So, for example, I was able to I couldn't record this interview, but I was able to interview someone who's a worker and a member of New Labor in New Brunswick, which is an organization that helps to protect particularly immigrant families and workers and provide better quality working place situations for them. And she shared with me that she has been working in the factory where she's worked, and they do have protective equipment, but they've been unable to maintain social distance while working, which makes sense in many of those kinds of situations. And so she also talked about she did not lose her job, but she was off for a period of time when they closed. And then when she was able to go back, when the factory was open, she couldn't because the whole family had COVID in the household. And so they had to deplete their savings. And I give them credit for the fact that they obviously had been thinking ahead and had savings, but they had to deplete all of their savings just to maintain their rent and their electricity and those essential services. And she also highlighted that she did not get any government support during this time. And so it really put a real burden on them. And she finally was able to get back to work once she was clear of COVID. Also, the conflicting demands for childcare and work. And one of the other things she shared is that they have to pay for the internet so that her children could participate in school virtually, which put another burden financially on the family. So I'm going to play this video. This is an interview with a mom, and I think it'll be pretty obvious about her situation at home and sort of what has been happening since the beginning of COVID. So thanks, Jenny, for agreeing to do this interview today. We want to use this in our webinar to talk about what it's like being a parent during COVID, and sort of whatever stressors exist and sort of how you're coping. So I'm going to use your first name and only use your first name for your anonymity. But we really do appreciate you taking the time today.
No problem.
Okay, great. So just tell me a little bit about your family. How many people do you live with?
Sure.
Okay, go ahead.
Sure. So it's currently myself, my partner, James, and then our two kids. We have a daughter. She is almost 2.5, and our son is going to be a year in 2 weeks.
So you're pretty busy.
A little bit. That's what we signed up for.
Right, exactly. So what is your work? What do you do for a living, and what does your partner do for a living?
Sure. So currently, I work for the World Trade Center Health Program, which is under, a branch of the CDC. So we do monitoring and research with responders to 9/11. And I do a lot of patient communication, coordination of benefits, setting up referrals for both physical and mental health.
Okay.
A lot of phone calls, a lot of tracking of that sort of thing.
Okay, and how about James?
James unemployed, which actually was sudden because there was an issue with HR coming back. So he quit very suddenly, and then when the pandemic status struck, we were still in that limbo where they weren't in childcare, so he stayed home with them.
Okay.
So we have that, luxury, I guess.
Depends, but it cut into your income, obviously.
Yes, yeah. We're a single income household now. Yep.
So you just mentioned that you have a lot of, patient calls and things like that. So how do you manage that with 2 little kids in the house? You're working at home, I assume.
Yes. So we moved essentially all remote with the exception of, a few different, like procedures we just have to do in office, like just for security reasons for PHI. And so we're essentially totally remote. I don't have a home office, so I basically play like musical rooms. I'll start like in one room while everyone is asleep, And then when they all wake up and it gets busy in the living room, I take my laptop and move to a room where one child isn't going to be napping. And then, like Maddox was sleeping in our room. So he would go nap in our room. I would take Dakota's room and try to get some phone calls done. But Maddox is still nursing. So fitting that into the schedule as well with phone calls and everything. And then, when Maddox would wake up, I would switch from Dakota's room to Maddox's room, and then eventually their naps would overlap, so I'd come back out to the living room while they were both occupying the rooms napping. So just moving around a bit, but I was able to keep my 7 to 3 schedule, and both of my kids are late sleepers, so I was able to get work done until almost 9:30 in the living room area, and then take over the rooms where she wasn't sleeping.
So I think you can see the picture I showed before, and Jenny reflects that just the physical demands of trying to find a place to work. And I can relate to that today. I had to turn my house phone off. I had to get my pets out of here, and I don't have little kids at home. So it's quite a challenge. And I think many people are sort of struggling with that and how to give their kids enough time and space while working in small quarters in many situations. There were also the psychological demands of COVID. And these include the worry about the health of elderly parents and of kids, the worry about kids' academic progress while they're trying to learn from home, and the fears of infecting different family members by the person who has to go out to work. And again, the person from New Labor I had a chance to speak to who works in a factory, she shared with me that her kids are online. And they're in school online virtually, like many children currently. And so she can't monitor them while she's at work. That's part of the reason we couldn't do a video with her, because she was at work. So she could talk to us, but she wasn't able to participate in a video. Likewise, when she has her kids at home, she basically, has to trust that they're online, and then she checks in with them at the end of the day. She starts work, goes to work at 5:30 in the morning, so she can't even really monitor them getting online in the morning. So it becomes a real challenge for many people to try to make their work situation coincide or help with their kids' academic performance. So here's another video of a young mom and talking about her situation as a part of her work. Anna, thank you very much for joining me today to talk about COVID and stress. I appreciate it a whole lot. And so I just, as I said, I will only use your first name as we talk. So can you just tell me a little bit about your family situation?
Well, let's see. I am a single mother. I have a 16-month-old. She was at a school. What is it? A daycare, pretty much. It's a Head Start. There you go, Head Start.
Okay.
So, yeah, she started at 6 months there, and all of a sudden, this whole pandemic thing happened, and obviously it changed my life. It changed everybody's life, because I have to work with my mother and having her babysit my daughter while I go to work.
Okay.
But it's a little difficult, but we manage it as best as we can.
Yeah. Okay. And what kind of work do you do?
I am a dialysis technician, so I work in the medical field.
Okay.
Mm-hmm.
So you said your mom takes care of your daughter when you go to work. Is that?
Yes.
Okay.
Yes.
And so do you live on your own with your daughter, or?
Yes, I do.
You do. Okay. So you have your own place. Okay.
Yes.
Mm-hmm. And so since COVID, what has happened with your work?
Well, let's see. Well, it has been difficult, especially the first 3 weeks when COVID actually reached us,
Right.
In my facility.
Right.
So, unfortunately, my daughter couldn't go to school.
Mm-hmm.
She had to stay with her grandmother.
Right.
I work at 5:30 in the morning.
Whoa.
Yeah. And sometimes I don't leave from my job until 8 or 8:30 at night. So they are long hours. And throughout all this time, it's been very stressful on a personal note, since I work in a dialysis facility and you're so worried about catching this disease or this virus, really, and bringing it home, not only to your daughter, but who's asthmatic, because she has intermittent asthma. So
Okay.
it's very mild, thank God,
Right.
but it's a concern for me. And also, if say for example, if I would have had it and I had mild symptoms and my daughter didn't really have symptoms, and she goes to her grandmother's house,
Right.
To infect my mom and where she lives at with her,
Right.
it has been difficult. It was very stressful, especially the first 3 weeks.
Yeah.
The first
And
3 weeks.
did you continue to work your regular schedule? Have you been working this whole time? Okay.
Oh, yes.
So
Yes.
you were an essential worker. You didn't get any time off to deal with any of
No.
this?
No.
Okay. So what would you have done if your mother wasn't available?
Unfortunately, if my mother was not available, and I thank God that that she is, and she still is, I thank God. If my mother wasn't available, I wouldn't be able to work. I would have to speak with my management and tell them if they could either reduce my hours, or if I could start later, or I would have to do a leave of absence in reality, because if I don't have my mother to take care of my daughter, then I really have nobody else.
Yana, thank you very much for joining me today. So it's obvious that, I think from this and from other videos we'll talk about today, that there are huge gaps, as we know, in childcare and in support systems for taking care of children. And I think that's pretty obvious from what Ileana shared with us. And she came to us actually through a referral from the Ironbound Community Corporation in Elizabeth that we've worked with for many years. And that's the Head Start program that her daughter participates in. And I really appreciate the fact that she was able to talk with us about her experience. So we also know that there are a number of factors that contribute to stress, so that some folks are really more vulnerable to the effects of any kind of disruption in their lives. Those people who have less income and less job stability, and I think you see that from the videos. And also discrimination due to race or sexual orientation or social class. That makes it even that much harder for those individuals to deal with these kind of unpredictable and dangerous situations. Also, if you have fewer supports, Eliana highlighted that she has a mom who can help her. If she didn't, there would be no one to take care of her child, and then she wouldn't be able to work. And women, Hispanics, Asians, and families with children under the age of 18 or foreign born have higher worry and distress related to COVID. There are starting to be some papers published, such as the one by Fitzpatrick that I'm citing just this year, that are beginning to look at the outcomes and the stress associated with COVID and the kinds of families and the kinds of situations that make it more difficult to cope. So when we talk about stress, and I'm not going to go into great detail, but I do want to highlight one thing that I think we don't often think about. We're very focused on the mental health outcomes and the symptoms that you see on left here or on the slide that include things like physical symptoms. And some people are only aware of their physical symptoms in terms of stress, such as headaches and tight muscles and feeling breathless or fatigue. Others are much more aware of their own mental symptoms, such as worrying and feeling just like they're not thinking clearly, or maybe they're having sleep disruptions because of nightmares. There's also the emotional things of being more irritable, having anxiety and depression, which I just highlighted, and feeling sort of apathetic about and losing confidence in their ability to cope. And then the behavioral manifestations. So we do know that when people are under greater stress, and I think we've heard this in the news media, that they may be smoking more, they may be using drugs more, they may have more reliance on alcohol. So these are the kinds of things that can happen as a result of stress. But in addition, what we also know from some very innovative research that was first published by Sheldon Cohen is that stress may actually make you more vulnerable to viral illness. We don't yet know that about COVID, although some of our research, if some of you have joined us previously, is focused on trying to understand if those folks who are more stressed, are they more vulnerable to even getting COVID or having more adverse effects from COVID. And these innovative studies actually found people and looked at their stress levels and then exposed them to the virus of a cold, and found that those who were more highly stressed had more cold symptoms and more likely just to get the cold, and then it persisted longer. So stress can work on both ends of the continuum when it comes to a viral illness. And so it may increase susceptibility, and we want to determine whether or not that is a factor as well in the susceptibility to COVID. So I want to run this video just to share with you a bit about Jenny's family stress. So thinking about the whole time period that you've been home and working from home and the kids and everything, is there anything that you found to be stressful about the lockdown and this period?
Yes, that's really broad, right?
Yeah.
Or is that just about COVID? Is that about the lockdown? Is that about the economy? Is that about
everything? What do you want to comment on in terms of sort of where we are? And
yeah, it's very stressful. It's actually definitely contributed to the amount of time I'm taking for leave. I had always intended on taking off again for Maddox, especially, because I felt like I didn't get enough time in the first place. So, yes, but there was just like there's just a combination of things going on. Everybody's stuck at home. The kids haven't seen their grandparents, and that's hard on the grandparents and the kids and their aunts and uncles, and just traveling to places. It took a while for Dakota used to take a weekly trip with James when Maddox was really young to the grocery store, and that would be like their thing, and they still haven't really gone back. But on top of that, just not being able to visit family, and my grandmother passed away over the lockdown, and just everything that goes with that. And then on top of that, there are just a bunch of other issues related to the handling of COVID, and just other insightful things being said, and that just exacerbates the stress of everything else. Maybe not, there's not something personally going on in my household, but in the community and outside, there are a lot of things stressing, the fabric of everything. So yeah, that's stressful too.
So I think what this highlights is, and even as the video is playing, you can see the disruption just from little kids and trying to do things at home, but also that it isn't just what's going on in one's family and one's situation, but it's also the external environment and the unpredictability of the political situation, and not knowing how much support people are going to be able to get from the government or from public programs, that makes it even more difficult. So the stress of COVID challenges can result in added health challenges. Like I've mentioned, worry about family and friends contracting COVID is related in the literature most recently to increased anxiety and depression among some people, particularly if you're living with elderly individuals in your household, like the woman I talked about from New Labor. And also the woman from the Ironbound Community Corporation who spoke with us about relying on her mom and worrying about her mom getting COVID. Also, it's probably not surprising, but physical activity we know is good for stress. People who were not active before COVID have remained inactive, but also there have been reductions in physical activity for people who normally are more physically active, and they've had more increased screen time. And that's been associated with more symptoms of anxiety and depression. We know that if you can maintain physical activity, that you're going to do better with stress than if you don't maintain that activity, but it's hard to do during this time period. So Nora, you want to take over?
Yeah, so we'll hear now from Fabian and Henry, who are high school students in Camden. They're discussing what it was like during that early period of lockdown and the kind of isolation and experiences that they had.
Sorry, I forgot that I'm on for this.
Distancing yourself from the world at the start was really hard. Like, I know it's not that big of a deal, but like the only time I ever go out is when I used to go see friends, and I didn't see my friends for like quarantine started at March. I didn't see them until like August, late August is when we finally got to see each other again. It was rough, but it was all right. It's not much, nothing too crazy.
Yeah, that's about 6 months, right
there. That is. Yeah, oh, it did also like put my father out of work because my dad works in the entertainment business. So like he works, his job is all about people. So like for him, for Corona to be a thing, it kind of affected him in a really bad way because he was like the only source of income in our household. So
it's been really unorganized because, you know, I don't have to do anything specifically. Like sometimes I make out plans or have to go to work, but that's really it. My family, it's been all harder for them because my sister and like my brother, they have essential jobs, so they're really needed during this like pandemic and stuff. So they have to wake up early. They have to get their kids like settled for school and stuff and be with them to help them learn because they're super young, so they don't really know what they're doing. And then they have to go to work. They come back home. They have to make sure that they got their work done. And then it's just this cycle that's really monotonous and hard for them. But for me personally, it's pretty chill. I'm just vibing.
So here we notice, especially with Henry's comment at the end. He says he's just vibing. But here we notice that they really downplay their own stress and their own experience, and they're acutely aware of what their other family members are going through, and they really emphasize that in their videos, that their stress was manageable, but they were worried about, you know, parents, you know, Henry's sister and brother-in-law.
So Nora, is this the right video or do I go to the next?
I think the next one.
Mm-hmm. Okay.
So now we'll hear from Dimitrius. So Dimitrius is older. He's older than Henry and Fabian. He's a young adult. As I mentioned at the beginning of the presentation, he moved back to Camden when his college closed down. And he's starting his life. He's starting to live independently. So he talks about that experience, but he also mentions what it's like to experience the pandemic within this larger set of social conditions, and especially as a young Black man living in Camden. So you can start the video, Nancy.
Okay.
Your responsibilities, I don't know. I have an apartment, I have rent. And I don't know, I feel like, because I've also been trying to apply for new jobs, not really new jobs, but really just a second job to kind of like try and boost my income. So that I am making more than enough that I need for rent, so that I'm comfortable living and everything. I don't know, like I've applied to like places like left and right, and then I get like no type of feedback or callback or anything like that. So it's like, oh,
am I really going to be able to get another job, get a second job in time for like when like my rent really starts coming up? Because I've been, I was fortunate enough to move into a new place, into a new apartment that's actually being rented out by my godmother, my godparents. So they were, since everything with like COVID and everything, they were like, hey, just try and save up your money first few months or first couple months. Don't worry about rent. But like I have rent. I have like my first bill of rent coming up this next month. And it's like, oh, kind of getting close to October, like dang. So like dealing with that's been like slightly stressful. I even started door dashing this past month. I just most recently started door dashing, and like at the same time, it's not really worth door dashing at all. It's not. I'm not making as much as I'm not really making. I'm making more than I used to, but when I first tried door dashing a couple of years ago. But with everything, like having the new responsibilities that I have now, it's not cutting it. Like I'm driving around to make an income is a lot harder than finding a stationary workplace. I don't know. Like sometimes like I literally like stay up until like 2 o'clock, 3 o'clock in the morning, and I'm just like, okay, gotta think of ideas. Okay, gotta think of what's the next step. What's the right move? Things like that. Like, oh, what I'm gonna do tomorrow? Okay, go into work and get this done while I'm on my way to work. While I'm at work, like I gotta do this during my break. So like, yeah, that's like kind of like one of the a few stresses that have been things that have been kind of stressing me out a little bit. But like, I don't know. Everything else is kind of like, I don't know. Like, at the beginning of the pandemic and everything, and lockdown and quarantine, like Black Lives Matter movement was also I guess the right. I'm not sure if this would be the right word, but it was popping off, and like there were a lot of protests and everything going on at that same time, and I'm not sure if this still answers. I hope this is staying on topic of the question, but it was like during then, like when I did really want to protest, and the thing that was holding me back was COVID itself, and being around large groups of people, in large groups of people during this time, and then all the police brutality and things like that were surrounding protests, also like really. It honestly, like, it legitimately, like, terrified me. I can't lie about that. Like, I was, like, extremely terrified. And, like, even now, like, this time with, like, everything, like, how, like, with, like, the climate of, like, our society, this country and everything, it's, I don't know, like, that's just one of the things that are kind of, like, stuff like that's always on my mind. Like, oh, if I get pulled over today, like, is that going to be like the last time I'm ever able to get pulled over? But yeah.
So there's a lot that comes up in these two clips that we're showing here from Dimitrius's comments. So we see here he benefits from resources that he has through his family networks, like being able to save on rent for a couple of months because he's renting from his godmother. But there are limits to these resources and supports, and these limits are starting to surface in Dimitrius's life. But we also see that he's thinking about his future. He wants to make some extra income, and the gig economy is clearly not in delivering for him. He talks about door dashing, so delivering meals as part of and which is really unreliable and not sustainable. Then he also talks about just, thinking about his next move, thinking about his next step. So he's always trying to think ahead, plan ahead into this future that's really uncertain. And at the same time, there's these larger social conditions like protests against police brutality, but then also his own fears, not only of contracting COVID, but of being a victim of police brutality in his community. All right, we can go to the next slide.
Okay.
The responsibilities, I don't know, I have an apartment.
The next one.
Yeah, okay.
Yeah.
So some of the stress of COVID challenges can also result, as I mentioned earlier, in additional health challenges, including substance abuse, depression, anxiety, and also increased domestic violence. And these are other outcomes of what people are facing with regard to the stress of COVID. I think that what we observed in many of the conversations we had with individuals is that everyone is reflecting on some of the stress that they're experiencing and then saying, but I'm doing okay, I'm coping. And I think we're all trying to do that. But I think it's also important to acknowledge that we do experience additional symptoms and not to always be presenting like everything will be okay, I'm doing okay, because sometimes we need some extra help and it's hard to get that. I want to just pause for a moment here. We're doing okay on time, and just I want to encourage anyone who wants to speak up in the chat. We have someone monitoring it, and if you have something to add or you want to reflect on anything we've talked about, please interrupt. It's fine. We're happy to be interrupted. Okay, so again, this is Eliana talking about her situation. In terms of your own feelings of stress about all of this, what has that been like for you to sort of deal with it?
It has been very stressful. It's I would cry. I would cry to go to work. I would cry leaving work. I would pray every morning, every night, for God to take care of me and my family and the patients that I dealt with, and to not catch this virus and not to give it to anybody. It was very stressful. All I thought about was that. Yeah. And it kind of becomes in a way where you become panicked. Like you're panicking about it. Mm-hmm. You're so constantly worrying. You're so constantly worried about it. You think about it every day at times. Mm-hmm. That you even change yourself. Like you tell people, do this, do that, mm-hmm. And of course they do. Mm-hmm. And if they forget, you start to get upset about it. Mm-hmm. When you don't mean to be upset about it. And that's and I know that that's due to the stress to not, to not catch it. Right. And I just want to highlight here something. Actually, Mike Gottschalk shared an article with me that I hadn't seen, sort of about this, what that's now been termed coronaphobia, which I think is sort of interesting, but it's really coining a term for the fear and the emotional strain of COVID. And I think we've seen this even in just folks who are experiencing just how much toilet paper got sold on the market because everybody started hoarding things, and this sort of obsessive behavior to protect oneself, and trying to avoid being panicked, and yet also realizing that there are threats and that you need to prepare as much as possible. And so it has led some people to be even probably more cautious perhaps than they absolutely needed to be. In terms of your own field, do you expect that your daughter's going to be able to go back to school at any point? She's been out of school since March, right? Since March. Okay. The school is thinking about reopening in, I think it's in November. Okay. But I'm not so sure. Mm-hmm. It really depends on how this is going. If it starts to rise up, maybe the superintendent might not open. If it's where it's at now, he or she might consider to open it. I'm not so sure. The mayor, I'm not so sure the mayor might allow it to open or not. And that's with all schools, I guess. But as far as my daughter going to school, if it were to reopen, it's good for her since she's only 16 months for social reasons. The teacher's there to teach her. But I am concerned. I am concerned because you have people that, that are asymptomatic.
Right.
And being that people that are asymptomatic, those are easy to spread.
Right.
The easiest way to spread is from a person that has no symptoms at all.
Right. Absolutely. Right.
Right.
So now I'm just going to ask you one more question. And again, I appreciate your time. Is there anything that you see that's positive that's come out of this?
Well, personally, me, my mom, my sister, the family, in regards to the family, more appreciative, more aware. We teach each other. And I guess that's a positive side out of it. As far as the school is concerned, they are doing everything possible to make it as safe as possible.
Right.
So, and they have explained to me, the rules, regulations that they're taking upon in regards to opening. So, that's the positive side. As far as my job is concerned, there are some positives there. Obviously, I guess with every job there is an improvement. There's always going to be an improvement because this is so new.
Right.
But as far as my job is concerned, yes, there's been more of an improvement work-wise. But more aware and more understanding of this, and we just follow protocols and procedures.
So I think that part of what's highlighted here too is just to some extent, we all want to trust our systems and trust what's going on. But we also, that some of that trust has been eroded when we can't really rely on the safety of where our children are going to be, and the safety of other people in terms of wearing masks and doing the things they need to, which also increases some of the fear and anxiety that occurs. So Nora, you want to take this one?
Yeah, I'll take this one. There are also some questions coming through on the chat, which we will, if you've asked a question, we're close to the end here of our commentary, so we'll get to the questions right away. But we wanted to end on a somewhat kind of hopeful, positive note. This is Henry's comments about, or in response to the question of how can public health researchers connect with youth? And this is what he had to say.
To answer the question, I think one thing that they should know about our age group in general, like youth, is that we're really focused on the future and like what's going to happen in the future instead of like what's happening right now. So a way to get through to us would be to like talk about the future, because that's what we're really worried about, because everything's coming up, things are stressful, so we don't really care about what's going on right now. But obviously we can like make changes right now to change the future, because that's what we do care about. And like issues that they might not think that matters to them, but matters to us. Well, they have to understand that, like in terms of like social life and like mental health and other things like that, they have to understand those aspects of youth as well in order to be able to get to us. Because even though we are youth, we are still the future of the world, so they just have to keen in on that part, and I think like they would be able to get a bigger audience or like more understanding and comprehension from our group. Yeah.
And if only we had that same sort of forward, future-looking perspective at all levels of our political system. we can go to the next slide.
Amen to that. Okay.
To answer the question.
Okay, so just wrapping up here. So we can see from these clips, and Nancy and I know from our interviews that stress and coping look different in every household, depending on their access to resources, what their job is like, how many children they have. But everyone is cobbling together resources and supports right now. So for parents, their outlook is dominated by this perspective of, how do I just get through today? How do I get through this week? It seems to be that's about as far ahead as they can plan, as far ahead as they can think. As we know from Henry's comments just now, youth are thinking more long term. What is way down the road for me? What does that longer term future look like? We saw from the interviews with parents that there are new circumstances and changes every week, if not every day. And I was really struck from some of their comments about how fragile their routines are. So for example, with Ileana, if her mother were to get sick or couldn't, babysit one day, she would miss work. And everyone's comments underscored how we're really all on our own right now. There are some supports from government and community organizations, but those are a small part of the resources that people are pulling together to get through this pandemic, and we really are on our own. So with that, why don't I'll move to the questions that came through on the chat, and I'll just say if other questions or comments come up, please put them in. Carrie Butch and I are monitoring. So the first question that came through is, so how do people feel when they see others not wearing masks in stores or other public places? I've heard of arguments starting. It's become such a political issue. The youth talked about that in their comments, because I had asked them how their neighborhoods had changed. And I thought that they might talk more about how many people they see out on the street, how, maybe they're not running into as many people as they used to, but they talked a lot about masks and mask etiquette. So they're certainly thinking about it and feeling frustrated that family members and people in their community aren't wearing masks as much as they should. Nancy, did this come up in any of your interviews?
Not so much, because I was really more focused on the parenting aspect, but I think it's interesting what you said. And, I've seen certainly people get pretty angry about the non-compliance or partial compliance, where, you go to the store and they have a mask on, but it's below their nose, and so, it's not as helpful. So yeah, there is some of that. Although I do think that where we live, compliance is pretty good compared to some other situations.
Yeah, and we'll see. We'll see what compliance starts to look like as infection rates start to go up in some communities.
Right.
So another comment that came through and question is this: I have an autistic special needs child at home, and she is 100% virtual learning, which makes it very difficult to work full time and monitor her learning. I've reached out to the state for respite, but we get only 20 hours a month. I am unsure if there's anything else I could be doing. That is an incredibly difficult position to be in. So so this person is getting 5 hours of respite a week. So talk about stress. Nancy, none of the parents that you spoke to had special needs children at home. So that's a whole additional layer of stress.
Mm-hmm. Yeah, and I happen to have some knowledge also of a parent with an autistic child at home full time. And it really is almost impossible to accomplish what you need to with the virtual learning, because they need more supervision often than what a parent can give, and also maintain any other demands on their lives. But certainly we will keep this question, and perhaps we can look in to see whether there might be other supports, or if anyone out there knows of something in addition in the community, please speak up or let us know, because we'd like to try to help provide as much support as we can.
Yeah, so that's support coming from the state. which is not very much and certainly cannot be enough to get through this period. So there is, I think, what time? So it's 10:56. I know that Brian wants to make a comment just before we close. Any other questions? Nancy, I have a question for you.
Okay.
So, I mean, no one in our videos really admitted to being super stressed. They, you know, they really kind of, they tried to put this like kind of positive front up. And so how do you, Ileana was maybe the person who spoke, and Dimitrius as well. They spoke a bit more candidly about their stress, but why do you think it is that, especially like for youth or for parents, they're putting this positive face forward?
Well, first of all, I think they know they're being recorded and they're being interviewed for the purpose of this. And I don't have a relationship with those individuals a priori. So I think that part of it is just, most of us are trying to, when we at least talk to people we don't know well, we're trying to say, look, I'm doing okay, I'm coping. And most of us want to keep that face on and don't want to necessarily admit that, the level of stress or the level of symptoms we might be experiencing. So I think that's kind of a common response. I would expect that if I talk to them longer or periodically, then I would see more of the real stress that's going on. So I think we had another question, maybe.
We did. Let's take that question really quickly. So the question is, how do you deal with a spouse who is a Trump loyalist, sharing, and this is in quotes, those views? We're constantly in conflict about decisions, socializing. So not only are you in conflict, but you're also together all the time at home and having to make those small decisions about, well, those small but everyday decisions about socializing. And I would imagine mask wearing is probably coming up, and maybe even now, given comments from the president about the severity of COVID and the promise of all these new therapies, that maybe that has come up in conversation as well.
Yeah, and I think it's hard when you are in a situation where you have very different attitudes and feelings and information about COVID and what we should be doing. And so, then you sort of have to agree to disagree, which is not easy to do when you're in the same household. But that what you need to do to protect yourself may be different than your spouse. And in truth, it could put you at greater risk if your spouse it really doesn't believe that COVID is that serious as being presented currently by our president and people who think it's more like the flu. That's hard for all of us, because I think from where we come from, we're more driven by the science, which says that, this is not the flu. And so I'm, sympathetic to what you're describing. And I think, you have to just, like I said, agree to disagree, but follow your own belief and your own education about what's going on. But it's difficult.
So the one last question that we can take here is, have hair cortisol studies shown in relation with virus positivity or negativity? Nancy, that question is for you.
Yeah, we have not yet done the analysis. We've been waiting to some extent to see if we have more spikes in COVID infections, because when we collected the hair, that was actually when, thankfully, our rate in New Jersey was going down and healthcare workers were getting more PPE. But we will be going along, continuing to collect hair samples, and that will be from the university community. Sorry about the background noise. That will be, I'm sorry, from the hospital workers as well. So we will be continuing that and then analyzing it to take a look at susceptibility. But thanks for that question.
Okay, so now we have some closing comments from Brian. Brian Buckley. Yeah. Go ahead, Brian.
Sorry, just had to unmute. Not really closing comments as much as a plug for next week's presentations, which are going to be based on a study that we did for New Jersey Transit. New Jersey Transit, to their credit, jumped on the COVID issue very, very rapidly, realizing there was very little data out there to be drawn upon for decision making on how to protect the ridership. They contracted with Rutgers to do a study, and we turned around a study for them in kind of unprecedented timeline in less than 2 months. We evaluated the disinfection technologies that might be available on a bus, as well as protective technologies. And with any luck, we'll have 2 speakers from New Jersey Transit and the PI of the study, Pat Zari, from our Center for Advanced Infrastructure and Technology Institute, to talk about the studies and what New Jersey Transit's done to make it safer for their riders.
That sounds really exciting, Brian. I'm looking forward to it.
Very good. And I hope to see everybody back next week and then some.
So I think to close out, Nora, did you want to have any final remarks?
No, just want to thank everyone who tuned in today to our webinar for attending, and to thank Maria and Carrie for all of their work helping to organize the session.
Amen. And thanks to the folks in the community who made contact with us and allowed us to use their videos and their voices in this, because it made a big difference for us. So again, thank you to New Labor and that organization. Thank you to the Ironbound Community Corporation for connecting us, and also to CFET to connect us to the youth and young adults to talk about this situation. So thanks, everybody, and stay safe, and appreciate your attendance.